Senator from Louisiana.
Mr. President, I've been coming to the floor to speak about how can we go forward in a way which actually lowers lowers the cost of having health insurance for those who are on the exchanges and begin to build to a future where we lower the cost of health insurance and health care for everybody, whether you're on an Obamacare exchange or an employer-sponsored insurance or you name it. And so we know there's going to be a vote as part of this agreement to reopen the government on what to do about the exchanges. So we need to be thinking and talking about the solutions that are out there that benefit the American people. And of course, what the issue is underlying, people cannot afford their health insurance. They cannot afford their health care. Those are two different things, by the way. The cost of health care is what dictates, theoretically at least, the price of health insurance. If you lower the cost of health care, then you would lower the price of health insurance. I saw this as a physician practicing in a hospital for the uninsured for 20 years. I should say the uninsured and the poorly insured. There have been middle-income people who could not afford their insurance and or could not afford their health care. So how do we get out of it? Well, first, it's complicated. We've got to be creative, and we got to abandon set positions. Sometimes we're in this chamber, and all we do is stick to our guns, and if the other party suggests something, we automatically reject it. We've got to move beyond that, not as, oh my gosh, the other side proposes, I reject, but rather, wait a second, let's listen. Is there a solution here that can benefit the American people? Now, Obamacare tried to make, and has tried to make, health care affordable, health insurance affordable, by just throwing billions at it. And the problem with that doesn't make health care affordable. It just makes the health insurance premium less expensive for those who are on the exchanges. But this actually drives up the cost of insurance for some and does nothing about the underlying health care costs driving up the premiums for others. So what's my proposal? I would propose that we instead of paying insurance companies to manage more of our billions, why don't we trust the American people to manage their own resources, to manage their own care, with something which I call a pre-funded federal flexible spending account. Now let's first talk about the enhanced premium tax credit, which is the center of this discussion. Just a primer. Let's get the basics. There are two types of premium tax credits used to fund insurance for those who are on the Obamacare exchanges. One is the baseline tax credit in the original Obamacare law, which helps pay for the premiums for those who earn less than 400% of the federal poverty level. But that didn't control costs, and so during the COVID epidemic, the Biden administration put in something called the enhanced premium tax credit. It provides some additional benefits for those less than 400% of federal poverty, but it gave additional benefits for those above 400% of federal poverty. If you will, acknowledging that Obamacare had not controlled health care costs and premiums on the exchanges for those above 400% have become unaffordable. So let's be clear. The discussion we're having now is not about the baseline premium tax credits. It is about the enhanced premium tax credits, which started under the Biden administration. So it begs the question, why were enhanced premium tax credits necessary? Well, as we've said, the cost of health care has continued to rise. And you can argue that if you're going to an insurance company and you're saying, we're going to give you more money if health care costs more, that they do not have the incentive to help control those health care costs. Now, I am not here to bash insurance companies. They are essential to our society. So just put that out there. But if you have the choice of giving the money to the patient for her to manage it or giving it to the insurance company, I think we should give it to the patient. So the question is, can we put in programs that lower the cost of health care? How long will they take effect? And what do we do in the interim? Well, it's too soon this coming year to put in programs to lower the cost of health care. but it's not too soon, which is to say we can put in programs that empower patients to manage their costs and give them the money as opposed to giving it to the health insurance company. But to do that, we got to think differently. So, how do we lower costs for the coming year for the individual who's on the exchanges? Now, it's important to realize that the total cost of having health insurance is not just the premium, but it includes the deductible and the copay. So if you can help with the deductible and the copay, that is as effective or even more effective than helping with the premiums. So what I'm proposing is something which actually helps the patient become a wise consumer of health care, helping her with the premium and the copay, working with the health insurance policy, with the health insurance policy, but in a way which lowers their cost. Now, let me be clear. This is not the official Republican position. President Trump has endorsed the concept, but it's not, say, for Leader Thune. But I am the chairman of the Health, Education, Labor, and Pension Committee, which has jurisdiction over this, and we will be having hearings in the near future to address this. And my motivation is as a senator and as a doctor who wants to make health care more affordable for all Americans. So let's discuss what I'm calling a pre-funded, flexible, can you get my marks a lot again? A pre-funded flexible spending account. So first, here's what we currently have: an enhanced premium tax credit, which is going to take $26 billion next year and give it to insurance companies to tell the patient what she can buy and what she cannot buy. Now, I have a typo here, and I fixed it yesterday, but I got to fix it once more. 20% of the money, 20% of the $26 billion going out the door to help pay for insurance premiums actually will go for deductibles, will go for profit and overhead of the insurance company. So let me just change this right here. Again, I had a typo yesterday, I have a typo today. 20% of the money we're giving to the insurance companies under the enhanced premium tax credits goes for profit and it goes for administrative overhead. Only 80% goes to pay for the insurance premium, to pay for health care costs for the person who's the recipient. Let's speak of what I am describing, the pre-funded flexible savings account. Pre-funded because you take the enhanced premium tax credit, instead of giving it to the insurance company, you give it to the individual and her family through a flexible spending account. A flexible spending account which millions of Americans already have. She can use this money to pay for prescription drugs, for dental work, for medical care, eyeglasses, orthodontia, much more flexibility than through a traditional insurance policy. And the key thing is, whereas if we give the money to the insurance company, 20% goes for profit and overhead. If we give it to the patient, 100% goes to health care that she needs. 100% goes to her family's health care needs. 100%, not 80%. This is better value for the health care dollar. Next, please. Oh, I'm sorry. Do I have another slide or not? I have to stand on this floor. Now, who would get it? Every eligible American citizen on the exchange would receive a pre-funded flexible spending account equal in value to the enhanced premium tax credit they would have received had the money gone to their insurance company. It doesn't pay for insurance premiums, but it pays for the actual health care that they actually need. Now, I'm pleased to say, next slide, President Trump has tweeted in support of the concept. Now, of course, I'm pleased to be aligned with the president on this. He says he recommends that instead of giving hundreds of billions of dollars, and this is President Trump's rhetoric, to money-sucking insurance companies, the money should be sent directly to the people so they can purchase their own much better health care. Notice the caps. That is a President Trump tweet. I'm pleased to be aligned with the president, But for my Democratic colleagues that want to guarantee that whatever we pass will get a vote on the floor of the House of Representatives, this is effectively a guarantee that if we pass a program like this, it can get a vote on the floor of the House of Representatives. If the President asks Speaker Mike Johnson to bring it up for a vote, Speaker Johnson will. So if you're just thinking, just imagine, my Democratic colleagues, how do we get something that 100% of the money goes for real health care? It doesn't go to insurance companies where 20% goes for profit and overhead. It's a system already used by millions of Americans. And may I say, it all but guarantees to get a vote on the floor of the House of Representatives. This tweet gives them that assurance. Now, some immediately began to criticize the president, assuming that he was going to take all the money going for health insurance premiums and put it in one of these flexible spending accounts. That's not true. Go back to what I said earlier. We only are talking about the enhanced premium tax credits, which would pre-fund this flexible spending account. We are not talking about the baseline premium tax credits that are part of the original Obamacare article. By the way, Republicans want people to have coverage. This doctor who used to take care of the uninsured wants people to have coverage. Now, the more I've discussed this, and this is the fourth or fifth time I've given this talk, I'm pleased to say that some of my Democratic colleagues are saying, hey, we can talk about this. Not quite there yet, but I see the wisdom of it. I'm willing to move forward with it, and I thank them for that. I want everybody in the Senate to put aside their prejudice, which sometimes is that if one side proposes it, it must be wrong. And I'll say to my Democratic colleagues, what I am proposing with the pre-funded flexible spending account is actually more closely aligned with how the original authors of the Affordable Care Act wanted that legislation to be implemented. I find it ironic that some of my Democratic colleagues are rejecting something which is closer to the original bill. But I think they're rejecting it in part because of misunderstanding, lack of knowledge, and maybe for some because the Republican is proposing. Put that trench warfare mentality behind you. Think about it. Could this be better for the American people? Can this accomplish the goal of making the possession of health insurance and paying for my family's health care more affordable? Now, for those who think this is too complicated, let me say that 72% of Americans who get their health insurance through a federal employer, a state employer, a local employer, 72% of us have a flexible spending account. My family and I have a flexible spending account. 47% of Americans who are on private insurance have access to a flexible spending account. Doesn't mean they take it, but it just means they have access. Millions of Americans are already using flexible spending accounts. What I'm proposing, let's just give the same option to people who are on the individual exchanges. Now, and by the way, let me just make the point. My wife and I, our family, we are on the Obamacare Small Business Exchange. Everybody in Congress is on a Obamacare Small Business Exchange. I am getting my flexible spending account through an exchange. All we're saying is open up the window just a little bit to allow those who are on the individual exchanges to likewise access that which I am getting through the Small Business Exchange. This merely extends what is current law for some people on their health plan to extend it to those who are within the individual exchange. The federal government can take the laws, the tools, the vendors, the department it is already using and implement a pre-funded flexible spending account for those on the individual exchange. Why is that important? Because that can happen for plan year 2026. I'm asked, well, what are we going to do about the people next year? This is about next year. How can we help those folks signing up for insurance right now for 2026? This brings them benefit right now for 2026. Now, let me now kind of go through the differences between the enhanced premium tax credit and a federally funded flexible spending account. And this is kind of the money chart, if you will. If you're with me in concept that maybe this could work, hopefully, I can convince people who might be watching, my Democratic colleagues who might be listening, to give power to the patients instead of giving enhanced premium tax credits to insurance companies. Okay, who gets the money? Under the enhanced premium tax credit, the insurance company gets the money, and 20% of it goes for overhead and for profit. Under the pre-funded flexible spending account, a patient and the family controls the money. What can it be used for? The enhanced premium tax credit, it can be used for insurance premiums. Under the pre-funded flexible spending account, it can be used for real care, if you will. Dental visits, physician visits, eyeglasses, prescriptions, orthodontia. It has more flexibility than the traditional insurance policy has. Who makes the decision? Well, the golden rule. He who has the goal makes the rule. Under the enhanced premium tax credit going to insurance companies, the insurance company makes the decision. They decide what care you have, where you get it, and how much you are charged. When you have a pre-funded flexible spending account, the patient makes the difference. The patient makes the decision. She decides where the dollars go. I always use the feminine because women make 95% of healthcare decisions for themselves, their family, for their spouse, for their boyfriend. I always chuckle. Guys are the stupidest thing in the world when it comes to their healthcare. Maybe a couple other things. But the people that care about this are typically women, and so I speak to her. And does it lower cost? Under the enhanced premium tax credit, there's really minimal incentive for the insurance company to attempt to lower cost. So therefore, as costs go up, so do premiums. On the other hand, under a pre-funded flexible spending account, you empower patients to shop, which drives competition. One example, I was once stopped on the street by someone who had seen one of my talks, and she goes, "You talked about using cash or using my flexible spending account or using my health savings account to buy something." There was a MRI ordered for my son's shoulder. My deductible was $5,000. The MRI was going to cost $2,000. I was going to have to pay $2,000 for my son's MRI of his shoulder. And I said, "Wait, do you have a cash price?" "Oh, well, your cash price is $600. If you don't want to go through the insurance company, your cash price is $600. Now, the typical Obamacare plan has a deductible anywhere from $3,000 to $6,800. So if we're talking about an MRI costing $2,000, you're still within the deductible. If you have a flexible spending account, you're not paying for that out of your pocket. You're paying for it with your flexible spending account, and you can ask, what if I give you cash instead? And they'll give you the lower price, not the higher price if there's a lower cash price, and there often is. This turns that woman, that family, into an informed consumer, and that begins to drive down the cost. This is the essence of giving power to a patient. The patient picks the best deal for her health and the best deal for her family's pocketbook. The pre-funded flexible spending account doesn't treat someone like a dependent of the federal government. They treat them like somebody who can make wise decisions for themselves and empowers them to make wiser decisions than the insurance company itself can. Now, some will ask, how much money does it cost? The first year, depending on how we structure it, it might cost just as much as our enhanced premium tax credits. Why? Because we're going to take the amount of money that would go for the enhanced premium tax credit and put it into a pre-funded flexible spending account. My Democratic colleagues should like that. They should say, wait a second, okay, it's still given the same value. In fact, I would argue better value, because when you give it to the insurance company, 20% goes to profit and overhead, and when you give it to the patient, 100% goes to real care, but the cost the first year will be about the same. But I will repeat, the difference is where the money goes. Because it goes 100% for real care, there's more value for every federal dollar. And once more, It's in the family's vested interest, financial interest, to purchase wisely, and that begins to drive down health care costs. And that, coupled with other reforms in year 2 of this program, in year 2, would begin to reflect itself in lower premiums. So, to conclude, here's the choice before us. We can keep paying insurance companies to hide the cost of higher premiums behind confusing bills, rising premiums, in a system which actually raises costs for many. Or we can give the patient the tool and trust her to pay for her care directly at fair prices with transparency. If we will, it puts patients before insurance companies. It encourages competition. It encourages and rewards smart choices. It begins to make health care truly affordable, not by inflating subsidies, but by unleashing the power of the consumer. Let's stop writing blank checks to bureaucracies and insurance companies. Let's invest in our fellow Americans. If you will, invest in you. This is going to be a little risky. We're doing something different. We'll be saying, oh, I'm not just going to be a Democrat, I'm not just going to be a Republican, I'm actually going to try and come together to find a solution to benefit all Americans. Imagine that. Congress putting partisan politics behind us to come up with a creative solution that actually benefits Americans a little bit out of our comfort zone. It's what we should be doing every day. I call upon us to do that today. We have to be willing to take the risk to solve the problem, not be afraid to do something different. We have to be willing to tackle complex problems, not retreat to our trench, which is labeled Republican or Democrat, and be afraid to come out to find a creative solution. I'm a Republican, but more than that, I'm a doctor who for 20 years tried to care for those who could not afford their health care or their health insurance. I invite my 99 colleagues to join me trying to find affordable health care and affordable insurance for fellow Americans. Let's be creative. Let's do it. And let's not just reject a proposal because maybe my side or your side proposed it. Let's fix health care. Let's give patients the power. And with that, I yield.